Sunday talks about sex, baby. Sunday talks about you and me. Sunday talks about all the things pertaining to living with HIV. Let's talk about sex. Let's talk about sex. Hey, all right, it's Sunday. So you know what that means?
So people going to church, right?
No, that's not all.
Oh, okay.
No, they're doing that and having sex. Sex talks. That's what we're here to have, is some sex talks. Welcome to this episode of Sunday Sex Talks. I am Pastor Darrly Brown Jr., founding senior pastor of Kingdom Builders Christian Center, and also the testing specialist at Nebraska AIDS Project.
All right, and I am Tommy Young Dennis, and I am the outreach coordinator at Nebraska AIDS Project.
Yes. So we're back. If you've been following us, we have been discussing all things HIV, all the things that pertain to HIV. Again, not all exhaustive, but we are covering as much as we can in these 7 episodes. And so we are today diving into a topic that I think is super important. I think, first of all, for people that are living with HIV. So I think this is definitely targeted at that group. But then I think also it's important, and you can agree or disagree, to hold this conversation for individuals, family, and friends that surround people living with HIV, so that it kind of helps inform the ways in which they could support their loved ones.
Absolutely, and I don't know why you would even suggest that I would disagree with that. Because the fact of the matter is that, as people living with HIV, support is always necessary.
Yes. So medication adherence. Adhering to, sticking to one's medication plan as prescribed by their doctor. Before we kind of get too deep into that, I think we got to lay a little bit of foundation and discuss the goal of of an undetectable status, and discuss the U equals U. Let's talk a little bit about that.
So I think, we talked about it a little bit, whenever that was.
Whichever
episode.
Stick with us. Watch them all. That's how you catch them all. You watch them all, right?
Catch it. But here's the thing about U equals U. So U equals U stands for undetectable equals untransmittable. So you only can achieve an undetectable status by being and staying on your medication.
Okay.
Undetectable status occurs when the virus drops to just a tiny number, like where it's barely traceable in your body. That's when you achieve undetectable status. And then, of course, I want to uplift that untransmittable part, because if you are undetectable, you are untransmittable, which means you cannot pass HIV on to a loved one through sexual intercourse.
Hold on, friend. If I'm hearing you right, I'm hearing you say that actually medication adherence actually is a form of HIV prevention.
Absolutely.
So by someone obtaining that undetectable status, like you said, where there's this minimal amount of the virus still in the body, I like to describe it as we've taken the bullets out of the gun. The gun's still there.
There you go.
But we took the bullets out, right?
There you go.
And a gun with no bullets ain't gonna hurt nobody. That part. So, it is a form of prevention.
Yes.
So let's kind of talk a little bit about those benefits let's talk about the benefits of adherence for an individual themselves. Let's talk about what a lack of adherence could look like for them, what that could mean for them.
So lack of adherence on lack of adherence for someone living with HIV could mean that your viral count goes up,
okay,
and your CD4 count drops low.
Okay.
So viral count or viral load is the amount of the virus that's in your body, that's actively in your body. Your CD4 cell, otherwise known as like T cells or white blood cells, is going to be those fighter cells that are fighting your body, or fighting against the virus rather. So you always and I think I mentioned this before, you always want those white blood cells or T cells to be up, and you want viral load to be down. Mm-hmm. But if that viral load is up and your T cells are down, then HIV can really just do some damage.
HIV can be transmitted, right?
Transmitted.
And then for the individual, that then makes them more susceptible to other illnesses. Is that right?
Absolutely. Absolutely, because this is what I really want to uplift, and I think I did not uplift it enough last week or the week before, was that when someone who has HIV or AIDS, or I don't like using AIDS because that term is really outdated and antiquated, so I say advanced HIV. But either way, when someone has HIV or advanced HIV, and you hear about them passing away or dying or whatever the case might be, it's not HIV by itself that took somebody out of here. Mm-hmm. It's the opportunistic infection that HIV made room for. In order for that it basically allowed it to enter the body and just basically wreak havoc, because your body can't fight off HIV and, let's say, cancer or pneumonia or anything like that. So that's my myth buster for this episode.
Let's lift a little stigma here. Yeah. Let's be real clear about that. Yeah. What I hear you saying is that it is an inaccurate statement for anyone to say they died from HIV. Mm-hmm. Inaccurate statement. Mm-hmm. Because a person does not die from HIV. They can pass away due to complications that are related to their HIV diagnosis, but it's not the actual HIV itself.
There you go.
That has taken them out.
Absolutely.
I can appreciate that conversation.
Absolutely.
I appreciate that.
It's one that needs to be had.
It does, because we hear it so often, and we throw these things around, and before we know it, people adopt these things as fact and hold on to them as if they are the truth, and it's not science, right? Mm-hmm. And so we just want to be sure that we're promoting medically accurate information.
Absolutely.
Even when we're talking amongst our friends and family members, that we're utilizing this language appropriately. So let's talk a little bit. So in order to obtain that level where the CD4 count is up and the viral load is down, and you mentioned that is only able to be obtained by adhering to medication.
Yes.
And so I want to talk a little bit about the journey of HIV medication. Ooh. Talk to us a little bit about how HIV meds have really gone through a transformation process to arrive to where we are today.
So back in the early 80s, when HIV, when the pandemic was first taken off, there was a medication by the name of AZT. Mm-hmm. And that medication, it was toxic. That's the only way that I can put it. It was toxic. And in a lot of cases, if you ask some people, it was more hurtful to people than HIV was itself. Mm-hmm. But oftentimes in the early 80s, at the start of the pandemic, even up into the 90s, there wasn't a lot that was being done to control HIV. They were still doing the research, and things were moving. They were moving slow, but oftentimes people who are living with HIV were taking 15, 20, sometimes more than that pills a day, just to sustain a bare minimum level of health. It really wasn't an ideal way to live.
There's this cocktail.
Yeah, very cocktail.
This cocktail of medications where, because they're taking this pill, they also need this pill that then will combat the side effects of this pill, and then need another pill to side. And so there's
pill on top of 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 pill.
And several people would testify about feeling sicker, if you will, as a result of taking all of those medications. Oh, but now
But now.
HIV medication looks a lot different.
Absolutely.
Folks can take as few as one pill a day. Is that right?
Absolutely.
One pill a day.
One pill a day.
And it's important to, I think it's important to discuss not only how simple that one pill a day is now, and those side effects are very minimal. I remember from my own journey of when I began taking HIV medication, within the first couple months of diagnosis, I remember dealing with nausea. I remember dealing with some crazy dreams initially. Dreams that made no sense, that I have no idea from what part of the inner recesses of my mind they came from, but they were crazy. And I remember some stomach cramps. Those were things that I experienced. Are there any other things that you can think of that people have uplifted or that you even may have experienced yourself?
I mean, those were really like the common things. Like, mostly for me, it was the nauseousness. Oh my God. Like, first 2 weeks, I was just like, oh my God, just take the stomach, have it. But like those symptoms or side effects, they reversed. Like, they stopped after about 2 weeks, but boy, that was the longest 2 weeks of my life. Nauseousness was probably the biggest thing.
Gotcha. So let's back up just a little bit and talk about that process to getting on medication. Let's talk about because I think this is an important conversation, not just for a person living with HIV, but I think it is an important conversation for the individuals that support them as well to be aware of. Let's talk about what it looks like getting into care, that process of getting into care and deciding on which medication is the right one for you. Because there is now a list of options, right?
Yes. So I won't go into like the entire science.
Right.
I ain't got time.
It gets deep. It gets really deep.
But there are certain classes of medication.
Yeah.
So just keep that in the back of your mind.
Yeah.
But the process from diagnosis to actually getting into care is actually fairly simple. Really, what it relies on is you. Like, it relies on you, and there are resources that are available in order to get you engaged in care. Nebraska AIDS Project being one of the main ones here in Nebraska. I mean, I'm going to uplift my job.
As we should.
But essentially, from the time, like, diagnosis to first doctor's visits, like, all of this takes place within, ideally, 30 days from the time you receive your positive test result. Ideally engaged in care and on medication in 30 days. If we can make that happen sooner, then great.
And I've seen it happen a lot sooner.
Yes.
I've seen it happen sooner. And for some folks watching, they may feel like 30 days, oh my gosh, what a lot can happen in 30 days. And if we be perfectly honest, yes, this virus can be progressive and aggressive. However, 30 days, if we just be honest, is not a make or break situation.
Absolutely.
To be clear. And in addition to that, I think it's important to uplift that within those 30 days, it's not like there's nothing going on. Part of that linkage to care process is a confirmatory test. Is that right?
Absolutely. So there's a confirmatory test because for example, if you were to come to Nebraska AIDS Project to get a test, and let's say you tested reactive or preliminary positive. I say preliminary because it's not a definitive result. We would then send you to go get a blood draw.
Okay.
A blood draw is the only thing that can confirm acute HIV infection or HIV infection in general. Blood draw. So, and truly from the time that you go and get that blood draw, we can get those results within like 48 to 72 hours. So, sometimes in 24 hours in some cases, but 48 hours. From there, then that's when it becomes like, okay, let's talk about your schedule. When can you get into the doctor? When can the doctor see you? From there, it is just there is some additional testing because we have to find out what kind of medication your body's going to tolerate.
Right. So we're looking at things like kidney function, liver function, all of those sorts of things, to be sure or to be aware, I guess I should say, of where an individual is with regard to that, because some of these medications can have impacts on said things, right?
Yes. And what I want to uplift also, because it just popped in my head.
Come on.
Is that, so let's say, okay, you identify somebody living with HIV, I identify as someone living with HIV. We're on two different regimens.
Absolutely.
We're on two different regimens, so what works for you won't necessarily work for me.
That's it.
So I think that, so when I told you, I mentioned earlier that there are different classes of medication. It's important, like that's one thing that the doctors look at. They look at the strand of the virus, and then they look at what's, basically
how far along you are in
like what's going to work for you.
Yeah.
So I think I just wanted to uplift that because, I've heard some things like, I've heard like, oh well, they got this one pill that works for everybody, and that's not the case. Not the case.
And if you out of your medication, which you should not be because you should have got a refill on, but that's another conversation we'll get to in a minute. And that you cannot expect just because you have the same virus that you can take another person's prescription.
Absolutely.
Is that right?
Why would you want to?
Especially when you can go get your own. Which kind of leads me into the conversation around medication adherence. One of the things that I think is super important with getting a person into care is understanding where their head is.
Yes.
Concerning the diagnosis, concerning taking a pill at least a day for the rest of their life. For the foreseeable future, this medication will be taken. There's a lot of advancements towards a cure for HIV, but we ain't there yet.
Not there yet.
So, and we're confident that they can get there.
One of these days.
But as of right now,
it
looks like a pill, and they're even also they're in trial right now for the injectable medication where folks can come in and just receive an injection, and that'll be an option for folks that don't do well with taking pills on a daily basis. But I bring that up because if a person is not in the right headspace to take this medication consistently, there could be some adverse effects as a result of them not taking that medication consistently. Talk a little bit to us about what could happen for someone that begins taking their medication and then goes this extended period of time without taking it.
So first I want to uplift the fact that if you know someone who is living with HIV, and when we talk about headspace, I think it's important to it's not just whether, the fact that I have to take a pill every day. Sometimes there are other things that are going on in life. Like, for example, if you jobless or homeless or there are other circumstances at play that are going to keep you from being medically adherent to your prescriptions, then we want to be able to address it. Like I need to uplift our agency. I just have to. Like, that's why Nebraska AIDS Project exists.
That is roundabout care.
It provides wraparound services.
Absolutely.
Linkage to care. We want to address as many of those needs as we possibly can, because we understand that if you are living the best life that you possibly can, whether it be like house, working, car, things like that, we understand that if those needs are being met, like if food, things like that. If that's being met, then you're going to be more likely to be medically adherent and take your prescription, your pills every day. But back to what you lifted up was just like what could happen if you go extended amounts of time without taking medication, or if you take it inconsistently. There is something that is called resistance that can take effect. So basically, resistance occurs when basically it's kind of like your virus smartens up on you. It smartens up. So what you were currently taking, and then you stopped taking, and then you took it again, and then you stopped taking it again, like that. When you do that, that causes resistance, which basically means that that prescription that you were once prescribed will stop working. And then we have to find something else that's going to work. And that can complicate treatment.
That could impact the viral load. That could impact the CD4 count. That could impact... There are so many effects that could transpire as a result of that. And dare I say, there are other ways in which that virus begins to attack the body as well. And people end up dealing with several additional complications that they did not have to arrive at had medication adherence been a thing. So I heard you uplift the idea of a lot of social determinants of health. I heard you uplift the idea of housing and employment and being sure that there's food in the house and things of that sort, and how that impacts the long-term goal of someone's health and their adherence. I can't help but think, though, about the fact that there is the possibility that someone can have all of those needs met. They have a place to lay their head. There's food on the table. They are employed. All of these things are good for them. But there is this moment where they have decided, determined, felt down in their soul that they can't do it anymore. The pill a day is too much. The idea of continuing to combat this virus is too much. I believe there is a term when people reach that state. Can you just inform our viewers of what that term is and kind of what that may look like for folks?
It's medication fatigue. It happens to people who are battling other chronic illnesses, not just HIV. Medication fatigue is a very, very, very real thing. And it really just I think you described it, I wouldn't even try to do that justice at this point, is that, it just becomes or starts to feel like a burden. It starts to feel like a burden and you just get tired. And I'm not telling you what I heard. I'm telling you what I know. Testimony.
You hear me?
I think about a year and a half ago, close to 2 years ago, I was dealing with the same thing. I had been in this thing for about 9.5 years, and then I was just like, and at that time, I was taking 3 pills a day. Okay. There was 1 pill that I was taking once a day, and 2 pills that I would take, or another pill that I was taking twice a day. And it just became too much. Like my life was happening around me, and it just became too much to have to stop everything that I'm doing just to take a pill. And dare I say, I think that is probably what the mindset is for a lot of people who experience that, is that you just get tired.
So I think that part of it, because again, as someone that has gone down that road as well, that you have this moment where you feel like because I know that there are folks that are watching that are saying it's just 1 pill, or it's just 3 pills, and this is the matter between life and death for you. This is a matter of life and death for you. So it shouldn't feel like a burden. It should just feel like, and the reality is that you're not looking at it through the lens of 1 pill. You're not looking at it through that. You're looking at it through the lens of the entirety of the HIV experience, right?
Exactly.
It's the weight of the whole experience of whatever the diagnosis is. This isn't just an HIV conversation.
Yeah.
It is about the abundance of burdens that come with whatever that diagnosis is.
Absolutely.
And there is this mindset that, you know what, this is too much. And the pill feels like it's just that one last thing that it's too heavy of a load to bear.
And we could, I'm not gonna go down that road, but we can even talk about, like, if you're doing what you're supposed to do, and then, you know, taking that pill, and then all of a sudden, like, your viral load spikes a little bit, or your T cell count drop, then that also can lead to medication fatigue.
Exactly,
because you like,
for what?
For what? Why?
Absolutely.
Why?
Absolutely. So that being the case, let's reiterate, because here's what I think it's important to uplift, that for everyone, you have to, first of all, break it down. We don't eat a whole plate in one bite.
Mm-mm.
We cut it up, we chew it up, we do all of these things so that it is easier to digest.
Yes.
And I think that the complexity of HIV is no different.
Absolutely.
That you have to be careful not to try to handle every aspect of that HIV experience in one bite.
Exactly.
You got to cut it up. You deal with the appointment, and then separately deal with medication.
And then just deal with life. Like, take it as it comes. Like, there's no one way to do it, and you have to find the way that's going to work for you. And needless to say, you have support. Like, point blank period. You have support out there.
Oh, baby, we're here. We'll go to the appointment with you. We'll talk through it with you. We'll walk through it with you.
Exactly.
All of the things.
All of the things.
To be sure that you stay in care. I think another piece is just reminding yourself of your why.
Yeah. You preaching now.
Remind yourself of your why. Okay,
you took your hat off.
Shifted hats. That's why I do my introduction with both names, just in case I slide on in there. Is that you have to find your why. Yeah. Why are you taking this medication? Why are you engaging in care? Because you want to live your best life. Yes. Because you want to have access to a long and healthy life. And so it is necessary for you to do whatever it is that leads to that goal that you have set for yourself. Whatever that important thing is for you, that then has to be your reason for adhering to medication. So I think we need to wrap it on up.
I think so.
We've talked long enough.
We did a good job, and hopefully y'all are taking something from these videos. Hopefully these messages are resonating with you, and hopefully, like, you know, this is breaking the ice. This is breaking the ice, and don't be scared to ask questions. Y'all know how to get in touch with us.
That's it. So that medication adherence, look, it reduces the amount of the virus in the blood, which then reduces the ability to transmit the virus, which reduces HIV numbers, right? And equally important, contributes to you living
a long life, a normal life. I mean, because life don't change.
Baby, you have HIV. Excuse me. Yeah, you have HIV. HIV don't have you.
Period.
And so it is important to just live from that space. So we want to encourage everyone that is fallen out of care, make them calls and get yourself back in care. Reach out to us if you need to.
Absolutely.
And we'll be sure to jump the hurdles with and or sometimes for you to ensure that you are able to get back into care. If you have never been in care, this is the time to consider that for yourself. And for those that are in care, stay in care. That's it.
Stay in care.
So, that being said, we want y'all to have a great day.
Yes.
And more importantly, have the day that you want people living with HIV to have.
Exactly.
You got to cut it up. You deal with the appointment.
Deal with the medication.
Yeah.
And then deal with life, whatever comes after that. Because whatever comes after that,
Sorry, friend.
We got a whole
The vice presidential debate just
I promise
keeps
you.
haunting me.
I promise you, I ain't got white hair and I'm not Republican.
And not. Okay. Moving along.
Uh,
Baby, this is not the vice presidential debate. There's a whole fly that's flying through here that's trying to get on the. This ain't. I don't see Pence nowhere. I don't see him. Okay, moving right along. Let's carry on.